All right, well, good afternoon, everybody. My name is Rick Johnstone. I'm the Director of Benefits here at MCPS. And this afternoon, we have a presentation from CVS Caremark for the pre-65 retirees, as well as the SilverScript program for the Medicare covered individuals. So I'm going to ask if you can to please hold off on questions until we wrap things up. And then we'll have plenty of time for any questions that you may have through that. So with that, let me turn this over to Matt or Sue, whoever would like to, and we can begin.
Okay, sounds good. Thanks, Rick. I'll take it from here. So this is going to be for the pre-65 retirees here on the commercial side with Caremark. I just want to make sure before I get started that the screen you're seeing is okay.
Looks good, Matt.
Good.
It looks good. Cool. All right. So as we said, my name is Matt and I am the account manager here at CVS Caremark. The account manager position is basically your essential client advocate and day-to-day contact for Montgomery County Public Schools Benefits Office. At Caremark, we manage your prescription plan. This means that we make sure we have access to affordable medication when and where you need it. CVS Caremark works with Montgomery County Public Schools to provide you with prescription benefits. This includes determining what medications are covered under your plan, how much you'll pay for medications, and where you can fill prescriptions. CVS Caremark also gives you tools and services to help you stay on track with your medications and take care of your health so you can live your best life. Now, as you see down at the bottom, there is a link that you can follow at any time that'll give you a background of what CVS Caremark is all about. But basically, I just gave that whole summary there, but this will be available to you at any time. Caremark.com makes it easy for you to manage your medications from your desktop or your smart device. Once you register, you can review your plan details, see how much your medications will cost and find ways to save, find pharmacies in your plan network, refill your mail service prescriptions, view your prescription histories, and see your progress towards meeting your individual or family deductible. You can also set up alerts and reminders to help you stay on track. It is important that you remember to download the CVS Caremark app, which is different from the CVS Health app. Again, there's a link at the bottom of the screen here that'll show you digital tools that you can use throughout the app to really make it fully effective for you and use it to your most experience. So the next step is registering for Caremark.com. If you had CVS Caremark prescription benefits last year, you can register at any time. All you need is your member ID number. It's the ID that's provided on your Caremark card. Just remember that you won't see changes for the upcoming plan year until it starts on January 1st, 2022. You will use the same card and member ID you were using in 2021. Only new members will receive ID cards for the new year. If you're new to CVS Caremark, you can register on or after 2022. So as you explore your new plan, you may hear or read terms that you aren't familiar with. Here's a list of the common terms and what they mean for you. So now this is always going to be here for you guys if you need any questions or anything, and I'll be happy to answer anything on this slide once we get to the end of this presentation. So now we're looking at the 2022 plan. So as you can see, there are no changes here. You'll see the same copays as you saw in 2021, unless your prescription went through a formulary change or was removed from the formulary. Please remember to always check for alternatives or generics if you're seeing higher copays or copays outside of your plans listed. So the first copay you see under each list is for generic prescriptions. A generic medication has the same active ingredients as brand name medication and is usually your lowest cost option. The second you'll see under each list is for brand name prescriptions, while the third copay is for brand name prescriptions with no generics available. So these are known as preferred brand medications on the second line, which are medications that cost less under your benefit plan. Or as you see on the third line, you see non-preferred brand medications, which will be the highest cost option under your benefit plan. Sorry about that. So some medications that are covered under your plan require you to take additional steps or get additional approvals. These are the most common. So the first one we have is quantity limits. So quantity limits affect the amount of medication that is covered. Once you reach this limit, you'll have to pay the entire cost of this medication. The next one is step therapy. Step therapy may affect you if there is more than one medication that can be used to treat your condition and your doctor prescribes a non-preferred option. Step therapy will require you to try the preferred medication first. Leading off of this, you have prior authorization. So prior authorization just means that your doctor will need to provide some additional information on why you need this specific medication. Then there's dispense as written. Dispense as written means your pharmacist can't substitute a generic for brand name medication. You may have to pay more if your doctor indicates a dispense as written on your prescription. And then lastly, if we make a coverage decision that you and your doctor don't agree with, you have the right to ask us to reconsider our decision, which is called an appeal. Now, our last slide here is for maintenance choice. Your maintenance choice plan gives you the choice of filling prescriptions for medications you take regularly, such as high blood pressure, diabetes, or asthma medications, by mail or at CVS pharmacy in 90-day supplies. Either way, the cost is the same. The option is yours and what you're more comfortable with, either going to the pharmacy or receiving it by mail order. If you fill in 30-day supplies after 2 initial short-term fills or at any other pharmacy, your medications won't be covered and you will have to pay the entire cost. After 2 30-day supply fills, you will need to switch to a 90-day supply for maintenance medications, or you will have to pay the entire cost. If you need to transfer a prescription, the good news is that 90-day supplies usually cost less and they're more convenient. Visit caremark.com/movemymeds to transfer your prescription. If you ever need help tracking your RX mail order, there's a short video at the bottom of the screen that can help you do this. And that concludes the presentation. Thank you for listening and looking forward to another year.
Thank you, Matt. Again, there's a couple of areas that I'm sure there'll be some questions on, but if we can hold off, at least for right now, we'd also like to do the short presentation on the SilverScript program, which is for Medicare retirees. I don't know if Matt or Sue is going to do this one, but if you would like to launch that.
Sure, Rick, let me go ahead and just share my screen and I'll present that. Can everyone see my screen okay?
There you go, you're on full screen.
Okay, perfect. So for SilverScript, the 2022 plan copays remain the same from 21. So you'll still have your plan A and plan B. Your copays remain the same. And if you are a new member coming into SilverScript, you will receive a welcome packet with a formulary, your ID card, and additional information. So if you have some medications that you do have questions on to see if they're covered and what tier level they're covered on, you can review that, or you can also contact our customer care line just to ask regarding the plan if you want to know what upcoming copays may be for any medication that you have. And we do ask that if you are taking medications and there's an alternative generic, you can save money on your cost of your medication by taking generic medications versus brand. But this is definitely something you just want to discuss with your doctor to see something that it's applicable to you. Oops. And we do have maintenance choice, where if you do fill your prescriptions at a 90-day supply, the cost of your medication may be less if you compare to filling at a 30-day supply. And this is for maintenance medications like anything that's generic. And you can fill your prescriptions through the mail order service. This is something that is also cost efficient as well versus filling your medication at retail, and is also convenient. We also have a mobile app as well. Now, when you log in, it won't say SilverScript, it will just show as Caremark, which is the same thing, caremark.com. So if you do have an existing account and you want to utilize the mobile app, this is available to you as well. And with the mobile app, there's also digital tools as well to review your prescriptions and any refills that you have coming up. If you have misplaced your member ID card, you can also have that card available through the digital tools. And if you do need a physical card, you can always contact our customer care and we can mail out a replacement ID card as well. But that's kind of it for SilverScript. Short and not too many changes on.
Okay, well, thank you, Sue. Good news, I think, to keep this, simple and basic, is that the A and B plans for both pre and post Medicare are the same copay. So we do have that structure. There was a term earlier on a slide that talked about deductibles, but I think on the subsequent slide that Matt showed, and also I don't think it showed up on Sue's, but there are no deductibles on our prescription plans here. And for those on the Medicare side, we do not have a donut hole. You'll hear that when you start comparing. So if you go out and take a look at other commercial programs that are available, Part D, for the Medicare population, that's certainly fine. And you may find something that is better suited for you from a pricing standpoint. But when you do your comparison, you do want to make sure that you're comparing apples to apples. So make sure that you find out if there are any deductibles or if there's a donut hole, because on the Medicare plan that we have with SilverScript, we do not have that. It's just your straight copays and that's it. So at this point, we'll open it up for folks who would like to have any questions. I would ask if you could to just clarify if you are Medicare or not, just so that we know which side of the house you're with. But I'll open up now for any questions that you all may have.
I have a question.
Okay.
I'm Medicare eligible, and both my husband and I, we are currently not enrolled in the MCPS prescription plan, but enrolled in the other Medicare Part D prescription plans. And we're thinking of switching to the MCPS. So in order to make a comparison, I do need to see the formulary and know what tier levels our different prescriptions are. And I was wondering when and how that will be available.
The
That's
formulary
my first
is
question.
actually posted on our MCPS website, on our retirees benefit webpage.
But that's the 2021 formulary. I'm looking for the 2022 formulary.
Yep. And so we update it in February, right around February every year, we get the updated formularies. Now the formulary actually changes, I want to say a couple of times a year, and we just update it as we get it. But the newest version we should have, it's usually within the first month or so of the new year.
So if I enroll, I don't know for sure that my prescriptions are considered generic. So I have no way of knowing what the cost will be.
So you can utilize this year's formulary.
Okay.
There are, if there are major changes, like if one of your drugs falls off after you've enrolled and you've had it filled, within the first week or so of the new year, CareFirst or SilverScript, they will notify you when that drug is no longer available. But for the most part, there's very minor changes that happen to the formulary. So you could utilize the formulary that's out there right now to use your comparison and see what the cost would be, because if those drugs are still on there next year, the likelihood of them being at a different tier is very low.
Okay. And then a follow-up question, since I'm not currently enrolled in the MCPS plan, exactly what documentation do I need to provide in order to show evidence of coverage? Is a copy of our current prescription cards enough? What do I need to provide?
So as a retiree, to enroll in any of our medical or prescription plans, you just have to show prior proof of 12 months of coverage. So if your card, has your effective date on it, then it will be acceptable. If not, we would just need something that shows when that policy actually started.
Okay. Thank you. So you'd need, submitting together with the enrollment form, I'm keeping all the current coverage and adding prescription. So just copies of the fronts and backs of the current cards.
As long as there is an effective date on it. Are you enrolled in the medical plan with MCPS currently?
Medicare supplement, the vision, and the dental.
Okay, because I was gonna say, if you weren't enrolled in the medical side of things, then we would need a copy of your Medicare card. But if you're enrolled in that, then we should already have that on file. So it would just be the proof of prior 12 months of coverage along with that enrollment form 45522.
Okay.
And let me just add that if your card, because a lot of times cards do not show the dates, and I don't know how long you've been with them, but if you've got an online account with whatever plan this is, normally you can go in and they will have a section that will show your effective date of coverage, that you can print that off and show, 12 months prior. We don't have to go back to the beginning, but the past 12 months up to current is what we're looking for.
Okay, so just proof of coverage in 2021. Okay, all right, thank you, because the cards don't show effective date.
Yeah, so go online and go to your online account with that plan, and that
Okay.
should show your coverage dates.
Okay. All right, thank you.
Yes, I am not currently receiving benefits from MCPS. When I do, I will be receiving it in conjunction with Medicare. Naomi's questions were helpful, and I guess it's called formulary. If I don't have medical care right now, do I have access to the formulary to look up my different drugs? And could you kind of walk us through where it is on the web pages?
Sure. Yeah, everybody has access to, as a retiree, even active employees can find it. If you go to the MCPS website and you go to our retiree benefits page, which you can just search in the top left-hand or right-hand corner of the screen, there's a big search bar. You can put in, retiree benefits. It'll take you directly to the retiree benefits page. And then from there, you can elect what coverage you want more information on. So whether that's your medical plan, your prescription plan, dental, vision, and then you can drill around and even go farther to the specific plans. So if you want to look at the Care First medical policy or the Caremark Silver Script prescription policy, you would click on that. And once you get to that page, there'll be links for both our retiree benefit summary booklet as well as the formulary that we get from Caremark and Silver Script.
Actually, would it be possible to post in the chat the URL and I'll copy and paste it?
Sure, I can do that.
Okay, thank you.
I have a question, or maybe two. With the Silver Script, are we restricted to CVS, or can I go to Giant or Harris Teeter or Safeway or Walgreens or Target? Target is CVS. So that's
Okay.
part one of the question.
Okay, so on part one, I didn't hear if you were pre-Medicare or Medicare.
I'm on Silver Script, but
Silver Script. Okay.
Two is for non-Medicare people, my family.
Okay, so on the Medicare side for Silver Script, we do post and show that Medicare allows individuals to fill prescriptions at other, we'll say non-preferred locations. And so you can do so, but you may have a higher copay as a result. So what we generally suggest is, I mean, there's about as many, and I'm not promoting, a CVS, but there's about as many CVSs as there are Starbucks that are out there. They're everywhere. I mean, or I could say McDonald's, whatever, but we recommend that it is best for the best copay that you go to CVS to pick up your prescriptions. The same sort of goes for the active. It's not as required, but once you get into maintenance medications, one of the advantages of a number of years ago, Caremark actually purchased CVS, they merged, is that you can use the CVS as your mail order delivery. So, I mean, if you don't mind, or if you like having your medications, mailed to your home, so for like things that you take, basically for the rest of your life, the blood pressure, cholesterol, diabetic drugs, if you like those going to your home, that's fine, they'll ship them. But you can use the CVS as your long-term or your maintenance pickup for your 90-day supplies. So most folks find it handy, and I'm on some maintenance meds myself, that you just go to CVS, you pick those up, and then you pick up the rest of them. So you're not going in different locations, different places. It's just one-stop shopping, and you pop in, get them, and go. Another feature that they offer too is that with your medications, they can coordinate them so that they're all going to renew at the same time. I had started one medication and then started another one. And so rather than having them split, they actually coordinated them so you can get those all at one time in the same monthly supply. So that's a nice feature for the program as well.
Richard or Jessica, one last question for the time being that popped up. I have found on rare occasion that if I compare the price of a medication versus what I might be able to get on something called Good RX, the medication is cheaper on the Good RX. Is there a way to negotiate, let's say with CVS, and say, here's what you're charging me for a 90-day prescription or a 30-day prescription. Here's what Good RX is saying that I will have to pay?
Well, I understand where you're coming from, and there are some exceptions always to the standard. I would offer that if you find something like that, that you can go ahead and use that alternative, and that's certainly fine. That's your choice. The program that has been developed and worked with Caremark actually does provide some of the strongest, copays and costs on medications that I've seen in my career, and I've worked for some other organizations. But there are going to be situations where something like a Good RX, or there are a couple other, I'll call them like coupon type arrangements, where you might have a better cost basis. And if you do, then that's great. Go ahead and use it. But by and large, those are going to be the exception, not the rule for the medications.
Okay, thank you.
Sure. Any other questions? Should we move to the quiz? If you're trying to ask a question, we're not hearing you. You might be muted, so I'll give you another opportunity to unmute.
Hi, I have a question.
Sure.
Okay, I'll
Can you
wait.
hear? Yeah, no?
All right, let's go with Susan.
Oh, Susan, okay. I just received the SilverScript formulary in the mail today because my coverage just started this month in October, and it doesn't seem to have the same information about costs as in the retiree benefit summary. It doesn't make any mention of maintenance drugs like 90-day supplies. But so I'm just trying to understand what my costs are going to be going forward.
So your
So-
formulary lists the drugs that are covered and at what tier they're covered at. When you look in the retiree benefit summary booklet, that breaks down how much your copay is per tier. So you want to kind of use them together to figure out, you know what I mean? If you're paying for a generic drug and it's $10 for a 30-day supply, and you're filling it at a 90-day level, then you would, you know, multiply that copay by 3, and you would have your what you're going to pay for your 90-day supply. Or actually, I'm sorry, I'm actually saying that wrong, because on the chart there's a level. It actually tells you what you're going to pay for a 90-day supply.
Yeah, there's
So
actually 2.
yeah, I'm sorry. There's two charts. So it tells you what you pay for a 30-day and what you pay for a 90-day mail order supply or your maintenance. So that's what you can expect to pay for that tier drug. So you have to figure out what tier it's on, and then you look at the chart and say, okay, this is what I'm going to pay for that drug.
Okay, well, that's, so I've just become Medicare eligible, so I'm going with SilverScript now. And this is a big increase in the cost of my medication compared to when I had CVS Caremark before I became Medicare eligible.
Yep.
Just as an example, I get Synthroid, a 90-day supply, currently at the pharmacy for $20. And according to this, it's going to be $50 if I'm reading it right, or $70. And so I don't understand why it's such a big increase.
Well, that would mean that it switched tiers, because if you're paying a $20 copay now, that would be at a generic level. And the $50 copay would be for a preferred brand name.
Well, maybe this is just I was under the impression that Caremark had Synthroid as a preferred brand. Synthroid brand as a preferred brand.
So without looking at the formulary, I can't really, give you a definitive answer. But this would be something that if you want to call in or write into our office, that we can, do the comparison and see what exactly you're looking at, because it may still be a generic drug and you're just looking at the preferred brand name tier.
Well, okay, I guess this is just particular to me, but I need to take the brand name rather than a generic because I had thyroid cancer. So maybe that's just a special circumstance. So, okay, well, on to the next question then. Thank you.
Susan, this is
Yeah.
another person, and I have the exact same problem, and what you're looking at does seem to be correct. But anyway, maybe we can get a more definitive answer individually. But yes, thank you for bringing up that point, because that was my point too. So thank you.
Oh, all right. Well, I know I did have, at one point, I did have to submit a letter from my doctor saying that I needed a name brand rather than a generic because I had this thyroid cancer. So maybe I just need to resubmit, or I don't know. I guess I'll find out.
Yeah, what I might suggest, it really is since you're actively in SilverScript now, is to give their call center a call and walk through that specific issue you just did, and the call center rep is going to be able to give you some guidance that if there's a pre-authorization or something along those lines, that they can address that for your specific need.
Well, yeah, see, I did, before I got this formulary or anything, I did call them and they said it would be $15 for a 90-day supply of brand name Synthroid, which is not in alignment with any of this. So yeah, I don't quite know what to do.
Well, If you want to give us an email or call, that's fine. But normally, because they're dealing with the pharmacist there on site at the plans, they normally can zero in on your specifics pretty quickly, because they can also look up your history.
Okay. All right, thank you.
Sure.
So thank you, Jessica, for sending that you all are URL. So I was looking up Restasis, and if it's not on the list, that means it's not covered at all by the medical RX plan.
Correct, if it's not on the formulary.
Oh, okay. So you would either need to find another version or a generic version if it exists, and if it doesn't exist, you just don't have coverage for that drug.
You wouldn't have coverage under your Caremark or SilverScript card, no. But like a gentleman offered out earlier, you can look into using like a good RX plan, which are free discount policies, things like that.
There also
Okay.
may be alternatives. And again, that's a lot of times why we suggest you call, Caremark or SilverScript directly, because they can look up the type of medication and offer some alternatives that are similar or similar like. Again, that's between you and your doctor, and Caremark or SilverScript can assist on that. But that's another service that they can also provide.
Okay, thank you.
Sure.
Jessica, this is David again. If there are no changes and want to keep the current plan that we have, don't have to do anything. It's automatically just transitions over to the new year, correct?
Correct. If you do have our life insurance, if you maintained your life insurance into retirement, that would be the only thing I would suggest, is just to submit that 45522 to keep those up to date, your beneficiaries up to date. But you can check no change for all your medical plans. But if you don't want to even do that, you don't have to do that. It's fine. And your plan, your benefits will roll into 2022 as they are now.
Okay, and slightly off topic but related, I have a daughter who is currently under my plan who will age out.
Okay. So
will
when
there
does
be a
she turn 26 or 24?
end of January 2022. So is
Okay.
there a list somewhere I can go and see what the COBRA rates are for the various medical?
Yeah, I don't know that they're posted in the back of our retiree benefit book.
It is.
But
It's in the rate book.
it is in the back of the rate book. Okay. But she will get notified of COBRA probably early December. We usually try to do all of our age outs a month in advance. So she should get something to your address on file. So if she lives somewhere else, you'll want to just kind of keep an eye on your mail, because it will come in her name, but to your address. And it'll be from our third-party vendor Benefit Strategies. They're the ones who manage our COBRA policy. And then she would enroll and pay Benefit Strategies directly to enroll in COBRA.
And the figures that I saw in the benefits brochure or document, I think they were 2021. I'm assuming that the rates will be more or less the same.
Yeah, they'll coincide with our rates for 2022. So I don't know that I see COBRA in last year's booklet, but you can actually find that on our website too. If you go to the NCPS website and type in COBRA rates, it'll pull up the
I think
102% cost.
2021, but I'll just assume that it's more or less the same as 2020.
Yeah, I mean, it'll coincide with the current rates that we're going into for 2022.
Thank you.
Actually, if you take a look in the rate book, on page 4, we have the 102% COBRA cost, non-Medicare eligible individuals. So on the new booklet for 2022, it's right on page 4, and you can look at the specific monthly cost.
Thank you. I'll go do that now.
Okay, any other questions? We are ready for the quiz. All right. Well, listen, I want to thank folks from Caremark and SilverScript for being on with us today. This concludes, our official time for the presentation and questions. If there are questions, you certainly can ask them. I actually remain on for anybody who may show up later, got stuck in traffic trying to get back home to get logged on. So unless there are other questions or concerns here, you folks can log off. And we appreciate your participation. And as always, you can give us a call at ERSC with any questions or concerns that you've got at 301-517-8100. And we are open from 8 until 4:30 for calls and questions. We also are going to have our Zoom support that's coming up here in another week or so, where you can register. If you come onto our website, you can register for some one-on-one Zoom support for enrollment or any questions on the coverages that we offer. So I wish you all a good afternoon. And if you got questions, you can still squeeze them in. Otherwise, you can log off.
Thank you, Richard. Thank you, Jessica.
Thank you all.
You're welcome.
Have a
Thank
good
you.
evening.
Bye.
This is Tony. Could you repeat that phone number, please?
Sure. The phone number is 301
Mhm,
517
mhm.
8100. It's also printed on our the RBS, the retiree benefit summary on the front, and the rate book as well, if you got those.
Oh, I did. Okay. I found it.
Okay, good.
Got it.
All right.
Thank you.
All right. Well, Matt and Sue, I appreciate your support on this, and I can swing it for the rest of the time that's here. We generally don't have too many folks that come on late, but do appreciate your support and on this, and we'll look forward to the active conversation we'll have next week. So if you guys want to sign off, you can. I can swing it from here.
Awesome. Thank you, Rick.
All right.
Thank you, Rick. Thank you,
All right.
Jessica.
Thank you, Jess.
All right,
Take
bye.
care.
Bye. Have a good one.
And Jess, I'll offer the same with you as well.
All right, sounds good. Did you see my message? You can stop the recording.
Yep, I'm going to right now.